Okay.
Hello.
Hi. This is Matt Larson for the Cranial Nerve Assessment, and this is my patient. We will begin now. Usually for the cranial nerves, for the first cranial nerve, that is tested through a neurologist by giving the patient vanilla or coffee, and that would be like the olfactory nerve. But we won't be doing that, so I'll move on to the next cranial nerve, the optic nerve. So for that, I will use the Snelling's chart, but I don't have one. But for the Snelling's chart to be tested for this cranial nerve, I would have my patient stand 20 feet away from a chart to look at, and they would test each row from biggest letters to the smallest letters, and they would go down each row reading them off, covering each eye and then both eyes at the very end. And they would go down and they would try and read each line of letters without missing three. Once they missed three, I would go up to the line above, and that's what I would record. Usually around, for most patients, a good normal vision is 20/20, but for this test, I would write down what they get or whatever. And then usually I would ask if they wear contacts or glasses, because a lot of people don't bring them to the emergency room. But for this test, I'll use the nursing assessment cranial test for the second cranial nerve. So what I'll do is I'll wiggle my fingers like this.
Oh, okay.
All right. How many? Let me know when you see them. Okay.
I see them right now.
How many fingers?
4.
Perfect. Okay. So that was the optic nerve, and then that would say the cranial nerve 2 is intact. Now onto the third optic nerve, or third cranial nerve, which is the oculomotor nerve. And so I will be using a starburst pattern to test that. So, and I'll be looking at their pupils. All right. You're going to follow my pen light, okay?
Alrighty.
All right, just follow it with just your eyes.
I don't think it's on.
No, it's not supposed to be on.
Oh.
Yeah, just follow it with your eyes. Perfect. And then for this test, I was looking for extraocular motor activity, which is also known as nystagmus. And he passed that, and then we'll be testing like Perla. And for the fourth cranial nerve, the trochlear nerve, that will be testing for accommodation for Perla. So what I'm going to do is I'm going to test your eyes. Just stare right here on my nose.
Okay.
Cover your one eye.
Oh, this one?
No. Don't. I'm looking at both your eyes. There you go. Keep them both open. All right. And now I'm going to test. You're going to look at this pen light, and you're just going to follow it, okay?
Okay.
Perfect. All right. So I conclude that this patient does have follow the guidelines for Perla. Pupils are round, reactive to light with accommodation. Round, reactive to light equal. Round, equal, and reactive to light. Pupils are equal, round, and reactive to light with accommodation. And for the accommodation part, that was for the fourth cranial nerve, the trochlear nerve, and so that was for the accommodation portion of that. And then and then I would also state for the third cranial nerve that all EOMs are conclusive. And then for the fifth cranial nerve, that would be the trigeminal nerve. And so we would have this patient test their jaw strength. Okay, so what you're going to do is you're going to move your hands against my resistance. Okay, move your and then you're going to close it like that. Perfect. Now I want to test the temporal areas. You're going to move your head that way. Like side to side like that. There, perfect. Now this one. Perfect. Good. And then, yeah. And then, can you say your name and date of birth, please?
Bradley Larson, 11/05/1998.
Okay. Next would be cranial. Okay, cranial nerve 5 is intact. Next would be cranial nerve 6, which is the abducens, but we already tested that with the starburst pattern. Looking for extraocular motions. So cranial nerve 6 intact. Next would be the cranial nerve 7, the facial nerve. And all right, so what you're gonna do is, can you chew for me? Chew like that. Perfect, perfect. Can you smile? Can you frown? Raise your eyebrows. Puff out your cheeks. Perfect. And then you are going to say your name and date of birth.
Again?
Yeah.
Okay, Bradley Larson, 11/05/1998.
All right, we were looking for labial speech, which he passed, which is all good. And then for the so cranial nerve 7 is intact. Cranial nerve 8, which is acoustic. We will. I will perform the whispering test. All right. What I'm going to do is I'm going to cover this here. I'm going to say a 2-syllable word, and you're going to say it back to me.
Flapjack.
All right.
Flapjack.
Perfect. All right, and then I can state that since the whispering test, both ears are equal and reactive, or no, they're both equals are bilaterally equal and reactive. Yes. And then for cranial nerve 8 is intact. Next is cranial nerve 9, the glossopharyngeal. That would be for can you say ah? Can you swallow for me? Like that. Now you're going to swallow again. I'm going to palpate your throat. Perfect. Cranial nerve 8 intact. Cranial nerve 9. Cranial nerve 9. No, that was cranial nerve 9. Acoustic is 8. Glossopharyngeal is 9. Okay. So cranial nerve 9 is intact. Cranial nerve 10, the vagus nerve. I'm going to have you see your name and date of birth again. I'm sorry.
Okay, 11/05/1998.
Your name?
Bradley Larson.
Okay, I did not hear any hoarseness in his speech or anything. And then I'm going to have you swallow again. Okay, thank you. Perfect. Cranial nerve 10 is intact. Now cranial nerve 11, spinal accessory. I'm going to have you shrug your shoulders for me. Shrug it. Thank you. Now you're going to press against my hand. No, just move your head. No, other way. There you go. This way. Down. Back. Perfect. All right. Then this would be done in the head to toe assessment, and then cranial nerve 11, the vagus nerve, is intact. And then cranial nerve 12, hypoglossal. I'm going to have you stick out your tongue. Can you? Side to side, thank you. The tongue is midline and no deviations.
I can do hot dog style.
And then back for the other like tasting of sensations. We didn't do this because we would have to like get gloves and like other components like for the gag reflex. I would stick a stick down, like a wooden stick, and test if he has a gag reflex, and then like taste sensation. I would taste, give him like a lemon or anything like that. Testing for the mucous membranes, and then for sensation around the face, I would take like a cotton ball and have him close his eyes and see if he can feel the cotton ball. And then for tearing, he would I would interact with his eye, try and make him tear up. But other than that, I think we're okay. That is the assessment of the cranial nerves. He has all cranial nerves are intact.
Sweet. Okay.